Greetings, everyone. Welcome to Information with Deidre. This is our show where we are spotlighting public health careers. Now, you may remember from before when I said there are some careers that are able to go across borders. They can transverse a lot of different fields. Some of those are C-suites, and some of those actually are not MPHs, but many of those people, just like we talked about people getting MDs and MPH, there's also such a thing as called Masters in Social Work or licensed clinical social worker. So today, I would like to welcome Miss Elaine O'Connell, who is a licensed clinical social worker, and she is going to speak with us today about her experience in her career and take us through some of that. So, Elaine, introduce yourself. What did you do? And give us a little bit more detail about your profession.
Okay, so my name's Elaine O'Connell, and I am a psychotherapist. I am currently in private practice. I work with perinatal and postpartum women, um, mostly focusing on postpartum and perinatal OCD. I also work with adults, children, and teenagers who have ADHD, OCD, and um, and some trauma and grief work because they're all kind of related to each other.
Oh, okay. That's awesome. So as I've kind of mentioned before, there are things that, go across different fields. And we know, like in public health, there's health law, there's maternal and child health, which is sort of what you mentioned based on what your clientele is. There's social and behavioral or community health, sometimes called neighborhood health.
Mm-hmm.
Um, so give us an idea. Everything's going off now. So give us an idea of which public health field you cover. I probably already said it, but
Well, so when I first started working, there was a lot of MPHs working with me. So I started my career off working in social services. I did a lot of work with hepatitis C. And for the most part, that was a social agency. We had a lot of MPHs coming in and doing a lot of social advocacy. They would do sometimes we were working in tandem. Sometimes they would do the same group I could do. And so that was primarily focusing on addressing the depression and anxiety that comes with treatment for hepatitis C. Um, and then I started to work in serious mental illness like schizophrenia, bipolar disorder, or dual diagnosis. And there, again, you'll see a lot of MPHs. And sometimes you'll see MSWs who also have an MPH.
Mm-hmm.
And again, so there's two types. There's people who work more like the macro level, and MSWs and MPHs tend to work in tandem there. And then there's people who do direct client services, and that's people that you'll see. Usually the MSWs are the ones we are allowed to assess, diagnose, and treat mental illness,
Mm-hmm.
whereas the MPHs address it on a larger scale, on a population level. And that's needed more now than it was ever needed before, especially in the post-COVID.
Post-COVID, I was going to say, it's a good example of infectious disease, right? Or communicable disease, like when you mentioned the Hep C work, So, and we talked a little bit about that, why like it's important to get into public health, especially like in a post-COVID world. We need as many people who are in those areas, whether it is a joint degree with another healthcare or social kind of area with the public health degree. They're needed. They're necessary.
Absolutely. Especially if you think about COVID has neurological impact. And so now you have people who survived COVID who have neurological impacts and deficits. So their life has changed. You're seeing mood and anxiety also in the umbrella. And also a lot of people, it's grief on a huge scale. So it's not just about treating the individual. We've got to make huge changes about how we're going to work with the population that is now grieving in a deep state of loss.
Yeah.
So it's pretty wild.
Yeah. So you talked about like, like some of the fields, maternal and child health, like communicable diseases, and I even gave us a little bit of your career path. What are some of the areas like so I'm always interested to know what are the job sites? Like what does that look like? The job sites in your profession, like the places that you've been stationed?
So I've been a lot of different places. Right now I'm in private practice, so that's just an outpatient office, and doing telehealth. So you can even do counseling now via phone, which is great for especially for working parents who are trying to make it work. Um, for the most part, we're in hospitals, schools, government agencies, social agencies. There's even like a sector now of like mind body. So we're in yoga studios. They're
Okay.
like everywhere now. I'm trying to think of, and there's also you can do some consultation as well.
Okay. All right. That's good to know. Yoga studios.
Yeah.
Who thunk it?
Or people are starting to open up their own like centers that have a whole focus on wellness, including
Mm-hmm.
health. So
Yeah.
you can really do a lot with this degree.
Yeah, that's interesting. Like, I think this is why we're doing this, right? Because, I know for me, if there was something like this to say, these are the things that you can do with the degree, I wouldn't have had like such tunnel vision. Like, I think like where I ended up now, like I can maybe be considered public health poster child because it's like I went to school for my MPH and I'm doing something in my MPH. Because, we know like when
Yeah.
people go to school sometimes, you may not be doing anything that you went to school for. And I'm actually doing like almost exactly what I went to school for, but like I'm in one of the niches. But had I known, it'd just be interesting to know what pathway I probably gone down had I, been able to find something to say you can do this, 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 and this.
Mm-hmm.
But when I remember like being in school, the focus was there's 40 million people that are uninsured, right? So now we have the Affordable Care Act, and there's so many different things. Everybody wants to look at. I'm gonna bother somebody when I say this. Everybody wants to look at intersectionality, which I think is good because we know that in these professions, though, they do tend to be siloed. So the way that people are moving now, where you are finding how to treat people holistically, I do think that that is beneficial. That is
Oh,
good.
absolutely.
You can't just be like, I'm gonna focus on. We know how public health and like social. You have diabetes. I'm gonna focus on this. It's
Mm-hmm.
tobacco. Focus on, and we have
Absolutely. But that's why I like when they have dual degrees because it's,
right.
someone who has an MPH and an MSW is going to think differently about, where is that center going? How are we going to, enlist the people in the community? Um, it's just done differently. Whereas
Yeah.
sometimes if you're an
Yeah.
exclusively an MSW, you're just kind of, you're opening it up in your neighborhood because it's
Right.
given to you.
Yeah. And I think like, I would have done a dual degree myself, like, health law or either the MBA MPH, right?
I could see that.
Those that would and I don't know why I didn't. I think I was like, it's like, okay, school. Let's just get this, let's go. Let's
Well, that's
go.
the problem with these degrees. They're all so long
They're
that
long.
if you and you're supposed to get these degrees when you're so young and you don't know.
What you really want to do, and
Yeah,
that's exactly what I did. It was like because a lot of places um they like to make sure it's about like prestige, right? So they can say like, we all of our staff are specialized and experts because they have PhDs and MPHs and they're published.
mm-hmm.
Yeah. So when you're coming out of school, like,
Yeah.
I went straight boom from undergrad into grad school because it's like we got to be
Same.
marketable, we got to, we got to
Yeah.
do all the so
I took about maybe like 3 years off and worked in a
smart.
St. Kettering Cancer Center, but in
Smart.
research. But that was still, I mean, it was all an attempt because I never really wanted to be a therapist. I thought it was corny, and I wanted to be something that was cool and creative. And then I took those classes and did horrible in them. And then I thought, okay, I'll do research. And then turns out I'm not very organized. And as you might remember, so the only thing I'm good at is connecting to people.
Right, but but those 3 years off, even though you thought it was corny, it kind of helped you figure out what you were actually really good,
Exactly.
and what you could excel at, and then help other people in the process.
And really, one thing led to another because we worked in cancer. So that led me to grief work.
Right.
And then through grief, I became immersed in trauma.
Hmm.
And through trauma, I started to see how untreated trauma has an impact on your genes. And so, how it activates genes that can now alter your children's neurology. And so it all started to.
It's generational curses, and it's passed down through blood. That traumatization, I like, even like the way you can be stressed about certain things. We talked about on another video I had, and also in the podcast. Make sure you catch True Health Live podcast, just released policing. How policing is stressing, certain communities, and what does that do to the people, and how that passes down to the children. And then we have a whole generation of people who are stressed out, and then how do they now interact and model for their children? Oh, this is how you're supposed to behave, so what is it hindering? There's a lack of being able to be free, right? So it's those generational curses and genetic curses that are passed down.
There's even my favorite study of all time is they had these mice, and they would, every time the mice ate cherries, they would zap them. And so the next generation of mice were born with an inherent fear of cherries. Isn't that amazing?
That is.
It's not like the mice, like the moms taught them, hey, stay away from cherries. But basically, what that shows is that those genes got activated. And now the next generation's more hypervigilant. So the same thing goes on with policing with a lot of things.
Yeah.
And that's why on a larger scale, it's really important that we treat trauma.
Right.
It has implications for schools, for future, for corporations down the line, for marriages. It's everywhere.
Say it again. Say it again. Falling apart. Even my scarf was like, you what? Say what? Say what? So we're actually like answering a lot of these questions. Like my next question was like, what was your career path? And you actually kind of like, gave some of that to us already. But if you can, like, so like just take us through like a real brief, from undergrad, so we heard a little bit about like, yeah, like research it. So take us from like undergrad to now, like a brief like synopsis, because this is for MPH students or people who are even looking at like career changes. Like, so how did you do that?
So, I mean, it goes back very, very long time ago before I was born. My mom is a psych nurse and she is obsessed with therapy, and she named me after her psychiatrist. So I clocked like 300 hours of training before I was born. And then I thought it was really corny because my mom was doing it. So I thought it was stupid. And I was always in therapy because she loved us being in therapy. And so when I got to college, I wanted to do something like, I either wanted to be a doctor or I wanted to do something very creative. My science skills were strong, but in the creativity, I am creative, but I not in like an artistic way, more in like a solution way. So I graduated with a psychology degree because that's basically all the credits I had, and which should have told me something, but I didn't at the time. So then I started working for Sloan Kettering, did research, and realized that my favorite part of it was talking to patients and connecting with them, and trying to, like, I was trying to elicit like a deeper connection than maybe was appropriate for my title at the time. So then I went back and got my MSW, started working at New York Presbyterian, and before Sloan Kettering, I worked at the Hepatitis C Project, then Sloan Kettering, then New York Presbyterian, and I was working mostly with people who were either in some sort of accident where they were dying and had to work with their families, or where maybe they had cancer, and so we were always like strategizing and giving them counseling around the diagnosis. But everyone was pretty traumatized, and it's really hard to go on living your life after a trauma because you're so hypervigilant and so activated that it changes your attention. So that led to, I started working in the victims intervention program, and doing some counseling with victims. And I just tend to notice that their kids all had ADHD and OCD.
Oh.
So I started to bring them into the session and started working with the kids. Um, and a lot of my patients were women. So women have babies. And so during that time, I was seeing them kind of throughout the entire like reproductive cycle. So, from as a woman who was without a child, woman pregnant with child, and then their children.
Mm-hmm.
And so eventually they all became my specialties.
Oh, that's amazing. Sometimes it takes us to like, kind of be dragged toward our purpose. Like
Absolutely.
dragged, and then you see it when you're there, you're like, oh, that's what you're trying to
Well, I mean, truth be told, I used to make fun of people in school who were studying to work with kids who
do.
had ADHD and autism, because I just thought it was like very candy striper. I was like, that's lame, that's not me. And meanwhile, I wanted the excitement of like, drama. But yeah, it dragged me to where I was supposed to be, which is focus. I'm obsessed with OCD and ADHD. So
Okay. So tell us about the day in the life of, like, give us like a story that's like, whether you found it inspirational, maybe something shocking without breaking HIPAA rules. We don't,
oh yeah,
we don't want the HIPAA to come
no,
after us.
no, no. That's sacred to me. So I would say like a day in the life. Well, today I worked. So now during COVID, I'm working from home,
Mm-hmm.
mostly on doing Zoom, or there's another website we use. This morning I worked with a couple who, one of the people have ADHD, and that really impacts their relationship. So I had to do some psychoeducation for both the patient and the wife, because sometimes ADHD symptoms can look like you don't care, but really you do care, and it's really intense. Um, so having to explain to the patient why they're doing what they're doing, um, neurologically, and then explaining that to the patient's family so they can figure out how are they going to work together.
Mm-hmm.
For
Yeah.
instance, a lot of people with ADHD don't give you eye contact,
Mm-hmm.
and that's where a lot of people get. Humans are built for that. We want to see it in your eyes. We want to know that the connection's there. But if you're not looking me in the eyes, I might, as your wife or girlfriend, think you don't care about me.
Right.
So that was one session. Another session was a woman who survived a really horrible disease that almost killed her, and now she's pregnant after um, all of that. And so dealing with life after you almost had death is complicated.
Mm-hmm.
Um, I also do, so we do peer supervision. So every week I meet with people who also are LCSWs, and we just lay our cases out on the table to make sure that we're not letting our own stuff come into the session, because that can happen. I mean, and sometimes it will tell you more about the patient. For instance, if someone gives me, if I'm working with someone who's narcissistic, I notice that I tend to get bored. And that likely is because someone with narcissism objectifies you, and they don't really care if you're there or not. It's all about them. So I feel like an object and I get bored. So supervision can help me understand that better, and just make sure that my own issues aren't showing up. We did peer supervision today. I'm doing this interview with you. Um, I mean, I have patients too. So OCD is a big spectrum. It's not just someone who washes their hands over and over again. So I work with a lot of women who have purely obsessional thoughts. So just getting like stuck on something. So this is women who are like, online shopping for like 3 hours, but they never buy anything. And I know that's a lot of us. So
I'm like,
you're like, go on. But just noticing that, like, when you're really charged, you're like hyper focused on this one topic. And so seeing that as like, it's not a sign of anything besides your neurology. This is how you're wired. When something gives you adrenaline, you tend to respond to that stimulant with hyperfocus.
Yeah. Like
Um,
editing YouTube videos perfect and trying to make, intros and outros. Yeah, I know what you mean.
no big deal. Welcome.
This is when they talk about like, undiagnosed. This is why, and I think like I've always said this to you. Sometimes it's good to go and lay down on the couch so someone can be objective and
Yeah,
show you like this is what's happening with you. Change it,
absolutely. Well, it's someone who has no skin in the game. So,
Mhm.
I can say to someone, hey, I'm trying to think of a good one. Uh, Rejection, sensitivity, dysphoria, my favorite saying of all time. I used to, if someone with ADHD is more prone to something called rejection, sensitivity, dysphoria, which just means like when someone gives you feedback, it's physically painful and it's distracting. So let's say you're like, hey, you know, Karen in accounting sends you an email and is like, hey, by the way, you did this wrong. Someone with ADHD responds in like a really big way and it hurts so bad and they're like so distracted because of that mistake. So I'll explain that to them and have them understand it's not, and therapy in and of itself won't treat that, neither will medication. So having them understand that like this is the way you're wired, and the reason why it's not getting better isn't because you're a failure or because you're fill in the blank some narrative you're going to come up with that's a myth.
Mm-hmm.
It's just because your prefrontal cortex is wired differently and you get flooded.
Mm-hmm.
So that's a lot easier to
Mm-hmm.
deal with than some intrinsic horrible flaw that you have that can't be corrected because you're just horrible.
Right. It's interesting because I truly like in my heart of hearts, and in my mind, I'm like, there's always something, it dawns in the orbit of spirit. And I know that gets into like another realm, and we're talking about like the very practical things, like the physical things that are going on. But I always think there's always like that supernatural, that metaphysical area that is definitely happening, is going on. And so it'd be interesting to think, okay, well, what's happening with you spiritually that is manifesting physically,
Absolutely, definitely.
yeah.
And I find a lot of my patients with ADHD specifically because they have this extra sensitivity. So there's a part of it called sensory processing disorder. And it's not really disorder, but it's just a difference. So they're very like they walk into a room and they get a lot of information from like the sounds, but they can also pick up things like what you're feeling
Mm-hmm.
without you even saying anything.
Right.
And so I think one of my favorite ways to treat that is to give it meaning and make it spiritual. Like, what are you going to do with that sensitivity that you were gifted? Are you
Right.
going to turn it in on yourself and use it as a weapon of destruction, or are you going to try to build with it?
Mm-hmm.
So I love that. Yeah.
That's awesome. Um, so we're gonna we're gonna winding it down, but before we do, give us like a pro, and something that you wish you could change about, I guess like the field, or like, what you've noticed, in your experience.
I mean, I love my job. It's amazing. Like, you literally get to help people have the lives they want to have. I mean, that's insane. It's amazing. But when you're starting out, pay is really awful. And it makes it hard to live.
Yeah.
Hopefully, that is getting better. And so you do need to have like a side hustle sometimes. And that's where additional, for me, I worked in a hospital and then I part time did private counseling, um,
Mm-hmm.
which was good. But, and I think that there's still a problem within psychiatry of the labels. And
Mm-hmm.
so no, a lot of the time people don't want a diagnosis necessarily. They just want a place to sit and talk and have this. I think this should be built in the same way that the checkups are built in. Um, and this is the problem when we're treating a label versus the person. You're going to mislabel them a lot. So I have plenty of girls, especially women, who come in with a diagnosis of depression, anxiety, eating disorder, borderline, you name it. And it's really just ADHD. It always was. Um, Or sometimes I have patients who have autism. Women, girls with autism look totally different than a boy with autism. And so, that's why I think we can get lost when we use the labels instead of what is the symptom, the issue that's driving the patient to want to come in. And I know that's where it's different from physical health, because if I have a sore throat, we want to know the root cause so we can get rid of it.
Right.
But when it comes to our mental health, there's a couple of ways to address treatment. You don't have to. I mean, some people use their church as psychotherapy. That's why a lot of priests and nuns have MSWs for that reason. So I think there's no reason for the labels to kind of take up the whole scene. It doesn't need to be like that. I think it should be really more about symptoms.
Everybody went, what's your diagnosis? I watched Girl Interrupted you.
Yeah.
What's your diagnosis? So you kind of like gave us a Easter egg in that last question, but so I'll see if it comes up again. So final question, what advice would you have for students aspiring to be in clinical psychology, or I'm sorry, the licensed clinical social work or psychology? Because that it all touches.
It's all, yeah. I would say two things. One is I would actually advise against going to a very high-priced university, because especially if you're going to work in the public sector, it just doesn't always. I mean, there's a couple of things. One, it doesn't align. Here is a for-profit college basically teaching you how to work in the public sector is a little, but also you're graduating with a ton of debt that is just really difficult for someone who's going to go into this career. And I think that a lot of the public institutions like CUNYs and SUNYs, they offer superior education in these areas and don't have the ticket price as well. So one, I wouldn't spend a ton of money on my education, and it's really hard to go to school to help people because you're gonna have to stop and examine yourself. And I know, especially when you're studying health, it's really easy to think you have everything that you're studying and wonder if you're what's what I'm looking for. Like, are you someone who can be an expert? So just kind of trusting that all of that greenness goes away. You're not going to be. You're going to become an expert eventually.
Yeah. Okay. Thank you, Miss Elaine O'Connell, LCSW, for joining us and giving us some of your wisdom in the field and helping some of our students, whether they be MPH or W or interested in a combination of the two. I think there were a lot of gems in there and things that are very practical and useful. I like what you said, like the honesty about maybe rethinking like a really big expensive university and the reality of like just starting out and what that looks like. I remember the salary when I first started. We won't talk about it.
Yeah,
that there's trauma there.
There is trauma there.
There's trauma.
I think the next generation of O'Connells is going to be very leery to go to an expensive school.
Yeah, if it falls below a certain number, there might be a reaction.
Absolutely. I mean, my husband, he's a professor at Essex County College, and the community colleges offer a wonderful place for you to get all of your requirements done, and if you want to do it that way, just save yourself that stress.
Yeah, and if you're a New York City resident, CUNY is free.
Free.
It's
free. Amazing.
For free. Free 99.
I gotta move back to New York.
We had a conversation Tuesday about money being a big stressor. And so one of the things that I wanted to share with people in the information is like, look and find the things that are out there. You can go to school for free. You don't have to go breaking the bank for things. And then you won't have to be like some of us who are just like, oh, I'm so happy the government is giving me a forbearance on the loan.
Yeah, exactly.
You go for free and I have to worry about it at all.
Yeah, Absolutely. Until they address this whole college tuition fiasco.
Yeah. All right. So thank you so much for joining us. If you have any questions for Mrs. O'Connell, you can put them down in the chat. Also, don't forget to like, share, subscribe, save the video, hit the bell, so that we can help all the public health students and students who are just interested in the public services. This was a really good conversation. So thanks again.
All right.
And
Thank you.
thank you. And we will see you in the forward. Peace.